you talk about CBT-I, which is CBT-I insomnia. But what if I don't have access to CBT-I, or if I have already done CBT-I and found it not that effective, or I just want to have CBT-I, then is there any other way of treating my insomnia? Of course, there is. And that's what this video is about, to discuss about the different kinds of models and the medications that might be useful when treating insomnia. Hi all, Dr. Raman Sakhuja, consultant psychiatrist and a professor of psychiatry in University of South Wales. Welcome to my YouTube channel. Here you can subscribe, like, share, comment, and please press that bell icon so that you get all notifications of all the upcoming videos. So if you have not already done so, please go and watch the videos on sleep and the videos on insomnia, where we talk about CBT-I and how it is effective and often the first line treatment for insomnia. After you've done that and you have still questions about other options, then come back to this video and watch it right till the end. So let's dive right in. When we are talking about insomnia treatments after CBT-I, the next thing that we would normally consider are the medications. And there are different medication options available for the treatment of insomnia. But before we understand the different medications, it is useful to understand a model that we call as a flip-flop model, which is often used in insomnia. So imagine that we have two switches of flip-flop. One side is our wakefulness, how we remain awake, alert, and on the other side is sleep that sets in. And we most often, as part of our normal physiology, we are flipping and flopping between wakefulness and sleepiness. So the medications that we often use are also utilizing that flip-flop model, where we can have medications that can promote sleep, and we can also have medications that can reduce the wakefulness to allow the sleep to set in. Whilst most of the medications that you might be aware of, often the Z drugs, the benzodiazepine group of drugs, or any others, are often the ones that are sleep promoters. But we now also have one of the new medications that targets the wakefulness side of the flip-flop model, and that is the one that acts on the orexin side of your receptors and the orexin system, which is the system that is responsible to remain awake. One of the things to think about or before considering taking medications is to discuss it with your professional clinician as to which one would be the most effective medication in your case, bearing in mind that some of the sleep promoters can interfere with some of the sleep stages and may not be the most effective in the long run, whilst the ones that act on the orexin system, on the wakefulness system, which are fairly new and we are gradually building up experience with that, can be much more effective. So whichever medication is decided or consulted with your professional, it is much better that don't go and take certain over-the-counter medication by yourself, but discuss it with the pharmacist or a medical professional who would be able to help you identify which one would be the most effective in that particular individual to treat the insomnia. So summarizing, what is important to understand is that when we look at insomnia treatment, number one, first line treatment is often CBT-I, which is Cognitive Behavioural Therapy for insomnia. If you haven't watched it, please go and watch that video that I have done on insomnia and CBT-I. The other options, if CBT-I has not been effective or not available, or for whatever reason has not been useful, then comes the role of the medications. And think about the medications which can be sleep promoters versus some ones that act on your wakefulness system in the brain. And if you have to consider medications for insomnia, it is always advisable to go and discuss with your clinician, the sleep specialist, or whoever the prescriber is to help you choose the right medication. So thanks for watching this video till the end, and please don't forget to subscribe, like, comment, share, and press that bell icon so that you get all notifications for all the upcoming videos. Have a good day, good night, good evening, wherever you are. See you up in the next video.